So borderline personality disorder is a term that's been around for a long time, but first became more of a valid diagnostic in the DSM-3, largely due to the work of Dr. John Gunderson, who did a lot of good field work and epidemiological work and good theoretical work, showing that BPD was a real problem. Since that time, that was in 1980, since that time, there have been a push to change the name. No one could agree on an alternative, so the name sticks around, even though the name itself doesn't really capture anything about the disorder. So the core of the disorder, from the perspective of family connections anyway, is we would say that emotion dysregulation is the centerpiece of the disorder. And one of the things that we know from psychological science for more than 100 years is that when our emotion is dysregulated, that has a big impact on our thinking. We can't think and problem solve. Our memory is terrible. And so we would call that cognitive dysregulation. So emotion dysregulation also causes cognitive dysregulation. And emotion dysregulation, of course, is rather painful. And so people will then engage in all kinds of activities to try to escape that pain. It's a lot of suffering. And sometimes those things that they do to escape it are pretty dysfunctional. They actually cause more problems, like suicide attempts or self-harm or substance use. We would call those things behavioral, overt behavioral dysregulation. But of course, having problems with emotion dysregulation means that relationships can become problematic. You really need a lot of help if you have dysregulation. If you just imagine having that much emotional pain, you're going to rely on other people for lots of different kinds of help. That's completely normal. But people can get kind of burned out, or they don't know what to do. And of course, people with BPD can become reactive. And that reactivity can look like enormous sadness or shame, more intra emotions, or it can look more like anger, which can, of course, feel pretty uncomfortable to people around them. So it creates interpersonal difficulties or interpersonal dysregulation. Because BPD also starts typically younger in our age, in teenage years or early adulthood, when our identity is also in flux, BPD can also be associated with problems in identity, like who am I, what do I want, what do I care about, and is there something that's going to happen to me? Are other people not going to like me if I'm this way or that way? So there can be this self-dysregulation as well. So there are these different areas of dysregulation that constitute borderline personality disorder.